Hi, good afternoon. Happy Thursday. This is Facebook Live. I'm Dr. Annette Mercatante.
And I'm Justin Westmiller, and welcome.
We're back to answer your questions. So let's start again with our weekly update on our data. You can see that we are solidly over the 1,000 official case marking with over 170 hospitalized. We've added 2 new deaths to our toll at 59. And the vast majority of people have recovered, 944 people, except for the 59 who haven't. We also are seeing some increases in our positivity testing. We're now at 3% positivity testing, although we're holding solid with the amount of testing we're doing per day. We're now at about 9.6, 9.9 I think was kind of officially. We're at basically 10 new cases a day, which is again that slow, low growth that we've been talking about for the last couple of weeks. The next slide does show the epidemiological curve. You can see the steady growth that we've been experiencing. We're almost back to our peak in mid-July. Of course, not reaching anywhere where we were seeing in mid-March. So hopefully we'll be looking very closely in the next several days to see a plateau. That is what our hope is, to see a plateau. And if we don't see the plateau and continue to see things increasing, we'll have a new conversation to talk about next week. Our next slide is the overall testing. Again, the steady amount of testing in the community with a little bit of stability with the percent positivity. You can't see that increase in positivity that we have at this point. Remember, this percent positivity is cumulative all the way through the entire event. So that will take a little bit longer to see that change if we're going up higher. And of course, just another plug to go to our website. Not only is a data dashboard there, but there's lots of good resources and information. We're always trying to update it and make sure that it's giving you the information you need. For instance, have we updated it yet for the rapid testing? We are looking. We're going to get there, and we're going to get our testing sites updated so you can see where the rapid testing is, which is right now all in Macomb County still, but it'll be more clearly labeled, so if you want a same-day test, you can see where you need to go. All of those tests, by the way, are antigen testing, which are most reliable if you're symptomatic. Okay, we're going to talk a lot more maybe over the course of the coming days about antigen testing, as it is going to become a more available test. But it has some limitations. We just have to understand what they are. Okay, let's get right to your questions. Do we have any available yet?
No.
Okay, so we're going to start with the questions that have come in earlier throughout the day and in the past week, and we'll go with them right now. So the first question, I'll just go right down so I won't miss any because I don't like them. I'll answer them anyways. The first one is Dr. Fauci says that if you notice community upticks in COVID-19, it could be an indication of an impending surge in cases. So since cases in our county have been steadily rising, is a COVID-19 surge a concern? Yes, it's a concern. Is it inevitable at this point? No, we don't believe so. There's some key indicators that I think are a little bit more reliable of a sudden increase. As you remember, surge would suggest to me that every several days we have an exponential growth. I always say, like back in March when this was happening, it was like watching a train steam down on us. And we were looking at doubling of cases every 3 to 4 days. Right. We would see the numbers double. So what we're doing now is watching. We've been at 10, for instance, for over 2-3 days, if not a week. So what we're going to look for, again, is that percent positivity test. So we assume that as long as we're around that 3% or less, in fact, the state uses a 7% marker for a red flag. We're going to get a little more concerned when we get closer to 5, but the idea is if the percent positivity tests remain low, that we'll be able to keep up with the cases and keep up with the case investigations and keep drawing that ring. And the other thing is just the percentage of positivity increasing, the increase in cases per day. If they increase every day by at least 10%, that is another measure that some communities have used. So we're watching that very closely, and as soon as we see some of these other indicators, we'll need to be talking about improved risk reduction measures. Okay? So that's the story about surge.
All right. How does the MDHHS order affect businesses in our area? The state health department director has created some orders that pretty closely mimic a few of the EOs that were invalidated last Friday. And how that is important to businesses, they must still follow those same rules and create the get to safety precautions for customers and staff. Basically, we have to follow exactly what's happening and make sure that we keep each other safe.
Yeah. So they were just rules issued under a different law.
Right.
So these rules were issued under the Public Health Code law, and the other was issued under that other one that was struck down, right?
Right.
Whatever that one was.
And what I learned through this too is the Public Health Code can be held up or can be put to use either by the local public health director, which is Dr. Mercatante, or the state public health director. So that's kind of the system we're working under right now while we figure out some of these legal issues at the state level.
Okay, first question. Not sure if you can answer this.
Okay.
Have there been any positives in the Head Start programs in the county?
The question is, has there been any positives in the Head Start program? We would have to check our database for that. I can't answer that off the top of my head. I would say that I wouldn't be surprised. We've had positive cases just about everywhere, young and old. Positive cases are identified. They're removed from their congregate settings. They're isolated and kept home until they're well. And then the contact tracing is done to see who's been exposed to them. Off the top of my head, I can't say. Although I would say that if you are in a program, your daycare, Head Start, school facility is generally informing people when that does occur. That is the standard of care, that you would be informed, not that you would be informed there is a case, and then you would be informed whether or not you yourself were an exposure, and if you weren't, then you just carry on. So that's generally the level of communication.
And
two more questions have come in.
I have a point to that too. And at this point in the pandemic, I would just hope that everybody understands that this can hit every facet of life. It doesn't matter who you are, where you are.
Obviously.
Precautions, you have a much higher possibility of getting sick.
From the highest to the lowest
That's right.
echelons of society.
Yep.
Yes, ma'am. Yes, sir.
Okay. Next question. Since when were there 2 new deaths?
Since when? Are they recent? Are they? Yeah, I think they were both recent deaths.
Yep.
I don't think these were delayed reports. The details of which I don't have on the top, but I can tell you one of them was hospitalized for quite a long time. The one we talked about this morning, and had been reported to us. We investigated it way back, I believe, in September. So unfortunately, sometimes these deaths occur after considerably prolonged illnesses,
Yep.
and that is kind of the unfortunate nature of this beast. But there are definitely 2 new ones compared to before.
Okay, next. Now the questions are coming in, Jen.
Okay, good.
I bet so.
Okay, you ready?
Yes.
Will you be enforcing the rules put out by the health department?
So the enforcement of the masks, the social distancing, and yes, we do have local authority, and our sheriff's department has authority to work as our what do you call that?
Work in
conjunction with
tandem,
us.
Yeah.
We have never gone out and issued tickets for the lack of a mask, but I can tell you it has to be put into perspective. So we have certain situations that look like they're becoming outbreaks. We're going to be a lot more focused on that facility or that program or that agency to make sure people are compliant. If somebody goes into a public space and is asked to put a mask on and they decline and become belligerent and a fight breaks out, the sheriff's department, law enforcement will come and deal with that very much like they would any other trespassing situation. So our businesses, our schools, our public sectors, they have the authority and the right to dictate whether or not you can receive services or enter their facilities with or without a mask. And so that's something we're hoping people are going to continue to enforce. And if we get complaints, we're doing the same thing with complaints we always have, is we reach out to the person who's being complained about, we talk to them, we educate them, we cajole them, and if that doesn't work, we report them to state resources if they're licensed, and we do, of course, have the ability to issue tickets, misdemeanors or civil fines.
Okay, back to the deaths question.
Yes.
Same person said that those 2 deaths were not reported yesterday or today, and then said 57 yesterday, then 59 today, question mark.
Yeah, that's the
Right.
2.
Yeah.
So we had 59, we had
They
2
weren't
more come in.
reported yesterday.
Remember that deaths have to be checked out. They have to be verified by our staff. Medical records are obtained and reviewed to make sure. That's why I know that COVID-related deaths are pretty good. I mean, they're not made up, because we don't just put them out there just because someone tells us they had COVID and they died. They have to have, a certificate that indicates their death was COVID-related. So.
Unless it has something to do with the dashboard.
So if our dashboard's delayed, I'm sorry, as I've talked to you many times before, the data that you get from me and from us at the health department is as close to real time as you can probably get. The state's dashboard is a week behind ours. So if you go to the My Safe Start, you're going to see a little bit different numbers. And if you're keeping your own track of numbers, you're probably going to see a little bit different numbers there too. So
Okay.
it evens out in the end.
Next question, how many active cases do we currently have in St. Clair and Sanilac counties?
Oh, we're not keeping cases in St. Clair and Sanilac County. Sanilac counties, once we identify that they live in Sanilac County, they're sent back to Sanilac County. And we don't really
track
have
that.
a direct tracking for that.
We can track. We
it
know
would be-
ours, but
it would
we
be
don't know
interesting
Sanilac
to know
counties.
that.
Yeah.
You can always check the My Start map.
Yeah.
Check the My Start map. There you go. So the My Start map, as I mentioned before, is a little bit delayed as far as real time, but you can get a snapshot idea of every county and the whole state using that My Start
Can we
app.
answer, though, the question of how many active cases?
Oh, active cases?
Yeah.
Clair County.
So what's the difference between
121.
121? Thank you very much.
And this person also feels that they should be kept in the loop on the numbers of confirmed cases, deaths, recovered cases, suspected cases, and currently active cases.
Okay, so data can get really confusing. The question was, look, we need to know a lot more about current, active, suspect, probable, confirmed. These are all epidemiological definitions that our staff is trained in. It requires a great deal of investigation, and I have to say expertise and training, and it's complicated. You could see somebody that's in a system as a probable, and then they could be moved to a confirmed, or they could be taken
Popped out,
out
yep.
and popped out, and that's why numbers shift so much. It's okay. Those details don't really change the overall picture, which is why we're trying to share with you trends and averages, because the day-to-day variations in numbers is going to blow your mind. It's going to make you confused. It makes all of us, so that's why we have information specialists and we have data systems, and we're constantly working on this. So my suggestion is to focus on daily average cases, percent positivity, as well as the information we share about direct impacts on our community, hospital capacity, the outbreaks that we're having within our systems, like our nursing home systems and our school systems. If cases start to impact on our school's ability to provide in-person learning, that's pretty significant. I don't care how many active cases we have. If they're all clustered in a place that's having a big impact on our ability to function, that's important. And so those broader questions really need more of our attention than the details of those numbers. And I apologize, I don't mean to be rude and say you don't need to know the numbers, but it's difficult. It's not quite as simple as just putting these numbers out. It is quite honestly a moving target every day, all day long.
Right.
So.
Okay, a couple more questions. What is the total number of positive cases to date in St. Clair County?
So cumulative number of positive cases, we covered that first. It's 1,124.
That's cumulative.
Yeah, that's
So
what they're
the
asking.
current positives, the active
Well,
cases,
Is 121.
Is 121.
Right.
So about 120 people that we know of that fall into the categories of confirmed or probable, that we consider positive cases, remember that for every case we know about, there's probably 10 or more, depending on the environment and the community, that we don't know about. Right. And that's what the national data is suggesting. So you can maybe safely assume that there's over 1,000 currently active cases in St. Clair County. So think about that. If you go to an event with over 100 people, there's a very good chance somebody there is going to be COVID positive and potentially infectious. Now the good news is not everybody who's COVID positive is infectious. We know that the infectivity, a transfer of infections from one person to the other, is not automatic. We know that proximity and timing matter, and also different people tend to shed the virus in different ways. We have some people who spread a lot and some people who can be positive, and there are no secondary cases at all despite exposure. So just think about the fact that our known cases equate probably to at least 10 times the amount of cases that are currently active in this county. And then you'll have a better perspective of your risk.
Okay, next question. What is going to happen when bars that are open who don't serve food are packed with no social distancing or masks?
So,
that's easy.
Yeah. They're going to get sick.
They're going to spread the virus, right.
But in the new order, one of the new orders that was put out, bars can open regardless to their percentage spent on alcohol, but they must remove the ability to enter dance floors or any congregate setting. Really, you can only have tables. They must be separated by 6 to 9 feet. So they have to follow the same rules that all restaurants follow and not allow congregate settings, even in bars.
And if people are seeing that, what should they do?
Leave.
That's the first thing you should do.
Let's make a really simple thing. With what our climate, politically, nationally, as well as in the state, is very clear that there are varying opinions about how to manage this. But there is no question how the virus works and what you need to do not to get infected. And that is not being close to people outside of your immediate circle. The more people that get together from various families, we talked about different social circles, the more likely you're going to get exposed and get infected. So, we're struggling all the time. How do we enforce this? You can see that this is not an easy thing to make people do the right thing. So do the right thing. And if you go into a place that's crowded, it doesn't seem to have those parameters in place, no one's wearing a mask, leave. Don't give them your business. That's my suggestion.
And remember, we're just trying to help you kind of make your way through this whole thing.
Right. Survive this.
That's right.
Let's get through this.
That's the end goal here, is that as many people as possible survive this virus that literally looks to take people out.
And remember, the longer you get through this without getting infected and then sharing that infection with other people, the more likely we'll have adequate treatments, the more likely we'll have good, reliable vaccines, we'll have more information about the virus, be able to give you more accurate information. This is just, unfortunately, it is a waiting game. It's something that we're going to know. Most of the time we have viruses we've known about for decades. This is a virus we've known about for less than a year. We're just, time is your friend. The longer you can wait to get infected, the better off you're going to be.
Okay, two more questions and then we'll go back to your sheets unless people ask more. Do any of the orders still stand from the governor?
No. So as of April 30th, the Supreme Court has ordered that all of the governor's EOs that are linked to the declaration of emergency under the Public Act of 1945, they are invalidated because, as per the court, the governor did not follow the policy of Public Act 390 of 1976, which is the current Emergency Management Act. So as soon as the legislature did not take up to continue the declaration back in April, they are all canceled. So they are null and void.
Numbers question. Are all of those numbers updated respectively? If a suspected case is confirmed, do they change both numbers?
Another numbers question.
So are all of those numbers updated respectively?
Are all the numbers? Yes. So the number is when we take, for instance, we take a case and it's in one category, and we investigate it and find out that it's not a case, or it's a case for a different community, or they've recovered. Yeah, all the numbers get adjust it accordingly. We try. I don't know how perfect we are, but we're pretty good about that. I think when they get moved, they get moved. And sometimes it happens at the end of the day, and sometimes it'll happen the following day, but it does get moved.
So the second part was, if a suspected case is confirmed, do they change both numbers?
Yeah, so we don't actually report on suspected cases. I think you've noticed that. In fact, that was the question. So if it's suspected, our internal investigative process, we report on confirmed and probable cases, okay, and deaths. And we report on recovered and hospitalizations so that we know how we're doing with that. But suspect cases are not reported, are they, publicly?
No.
Not publicly. No, that's an internal number. Because if they're suspect, it means that we don't know if they're positive or not, right? If they're suspect, they're suspect. And the investigation, if the investigation shows they're positive, they get moved. If the investigation shows that they're negative, they're just out. It's not a case, so it's not reported. I think that's the question you're asking. I hope that's the question you're asking.
Okay, next question. What happens as cases rise?
So that's easy. So as cases continue to rise, and if we continue to fall off the ledge a little more, or it gets a little more difficult to make it through this, then the mitigation strategies change depending on where you are, what your situation is, and potentially the local rules may change just depending on what the needs of the response are. Is that right?
Yeah, so advice would change, although it's generally, I say this over and again, we only have so many tools to offer you.
Right.
So maybe you would take that advice more seriously. Maybe you would consistently. Maybe you would make more different personal choices, and we as a health department may make different choices about how we provide testing or resources. Right. So we would just try and adjust what we do based on the level of risk, and hopefully you would make decisions and choices based on your own personal risk.
Okay.
So,
more questions?
Love it.
Good. We thought we'd have more
A couple
questions
people
today.
said thank you very much for answering.
We're trying. Yeah, these are
Appreciate
good questions, by the way. Keep them coming in.
Okay, this person apologizes for a long question, but here it is.
Okay.
At a social gathering, people are so critical about you wearing a mask, and most others don't. It's difficult to be around them, and it makes me feel bad to have to leave. How would you recommend dealing with this?
Boy, that's a really good question. We need maybe Deb Johnson or somebody from CMH to help us with this.
Yeah.
I consider wearing a mask not only something that shows that I care about my own personal health and that it's important that I show up for work every day, but it also shows that I care. I consider it an act of compassion. So if someone is ridiculing you for being compassionate, well, I think that's a badge of honor. Okay, I think you should be proud. Hold your head up and say, this is what I believe is best practice, and I believe in science, and I believe in taking care of each other, and I believe following the information that we know to be true at this time. This is a crisis, people, and I know we can downplay it. And somebody asked earlier, why do we do cumulative numbers? Well, we do cumulative numbers to put it in perspective. Compare it to other numbers that we keep track of. We can compare it to other states, other communities, because this is a big deal. This doesn't happen certainly in no one's lifetime.
Yeah.
So if you're in a crowd that doesn't believe it's important, it doesn't believe that you should be following it, maybe you're in the wrong crowd. And I wish I had a really good answer for you to say, but I'm proud of you and thank you for doing that. If everybody stood up and said, no, I believe wearing a mask is the right thing to do, maybe that norm would become a little bit more common. People tend to follow along what they're normally seeing. So maybe we need to establish a new norm in St. Clair County. That'd be really cool.
And I thought Director Gordon said it best in one of his statements. He said, we're not going to need these protections forever, but for now they're very much required. So we have to do what we have to do to get through this pandemic safely as possible, and understand our new levels of risk.
Okay. People want to know, can you talk about the spread in the schools and how much it is happening?
Spread in schools. So our schools, I'll be quite honest with you, it's probably every day that we identify and investigate a case that was in a school, whether it be a student or a staff member. However, the good news is that the policies and procedures that our schools have in place have prevented any widespread exposures as far as we can tell. In other words, we have not had any secondary cases within the schools as a result of those individuals being there. Without exception, so far, every case that has been identified has been infected outside of the school setting itself.
Right.
So they have been infected from their homes, from other situations that were not school related. So that's a big trigger, and it's something we're looking at very closely. So as long as our schools are able to do this, and our overall community spread is where it's at, even if it gets a little bit higher, we feel that it's reasonable to continue in-person learning. That environment is pretty well controlled. Situation may change if the transmission starts occurring within the schools, or we have such a large amount of transmission in our communities that the risk is just getting too great, and we just need to all back off again.
And a little more to that too. So, you know, when we're working with, we work with the superintendents and the school districts every day, and what we know that some of these individual cases at schools have created additional quarantines, but know that, like Doc said, none of those quarantines, luckily, have transitioned to a regular a case.
What we call those secondary cases. So you've been exposed, and then you come down and get sick, and we test you and you're positive. That's a secondary case to a known exposure.
Which means that we're doing the right things in schools right now, as Doc said, to continue that for now. But we have to remain flexible because we need to be able to shift back and forth. Just like Doc said a minute ago, to depending on what the situation is in the community.
And I know our schools are getting a lot of heat. They're getting a lot of pressure, and I want to give them a big shout out for doing the right thing. You know, they have a choice between taking this seriously and following our recommendations, or just kind of let things slide and just kind of open things up. And you have to weigh that risk benefit, and they're there to do the best they can for those students and keep them in school, and they're weighing in on the cautious side. And I believe it's working, and I think that's a very brave and admirable thing to do. I'm very proud of our school leaders and really all of our community leaders, though. Yeah. They're doing a good job.
Great.
Okay, our time is almost up, but I want to do one more question here, and then I don't know if you guys want to do a wrap-up.
Yeah, I figured we'd go a little late today anyway, so pretty big day.
So the last question up here so far is, the latest cases this past week, can you speak on them? Are they symptomatic? Do we know?
Well, most of the cases we get are symptomatic because, let's face it, people get tested when they're sick, all right? So I think you said 88% of our current cases have presented with symptoms. What did you say, Joe? The most common symptoms are cough, headache, and fatigue, followed by fever and muscle aches. So no surprises there. There was some literature that came out that said a loss of taste or smell, although rare is not a common, it is a very specific symptom of COVID. If you have a sudden loss of taste or smell, assume you have COVID until proven otherwise. But really these symptoms are pretty typical. And we're probably seeing a little bit more symptomatic because I think a lot of people aren't getting tested just for no reason. I think they're getting tested when they feel they're feeling poorly, which is fine. It's just that's kind of what we've got right now.
I just want to read one comment before you guys.
Absolutely.
Right.
This person said they went in a place the other day and was told by an employee that they could take their silly mask off and it was not required anymore. And this person walked out and said she won't be going there.
That's it.
That's what you do.
The mask is not silly, and it is required. It's required by the new executive order, but more importantly, it's smart. It's smart, it's smart, it's smart. Don't get caught in the rhetoric. This works. It helps reduce the transmission. What works best is not being exposed, but there's only so much you can do. So keep your distance, wear your mask. And please, if we call you and are trying to investigate a case, please answer our call and give us honest. We're not gonna discipline anyone or get mad. We really just need to know where that circle of exposures are, because that helps us stop the further spread. Very important, and we're doing a little better with that, I think. But try and be honest with us. It's really not we're not trying to harm you in any way or get people in trouble. Okay,
so let's wrap up, but Doc, I'd like you to talk about that flu versus COVID question that you had.
Okay, so a question that's coming up.
Justin, pick one off your sheet and let's
Sure.
call it a day.
Okay, so we're going to do one more question each because these questions come up a lot. And the one that's coming up a lot is why you feel about COVID when it's comparable to the flu? It's not. It's not comparable to the
Not at
flu.
all.
It's not the same virus. It doesn't have the same pathophysiology, big word, meaning it doesn't attack our bodies the same way. It has different impacts on our body. It is killing a lot more people than the flu does. We talked about death rates. So a typical flu season might kill anywhere from 10 to maybe 60,000 in a really horrible flu season, and that's estimated because flu deaths are not reportable deaths other than children's, but we can do that through modeling. Think about that. Nationally, at the very most, 35, 40,000 deaths in a typical flu season. We're at 210,000 deaths now,
Right.
in less than what a flu season usually spans, in less than a year. So this is not the flu. It is nothing like the flu, and we shouldn't treat it like the flu. The only thing that's going to be flu-like is that the symptoms are both respiratory, primarily, and now we're getting into a season where both conditions need to be considered if you get sick.
And interesting with those numbers too, more than 2 million states and more than 25 million people around the world, right? And I think 172 plus countries at this point. So that is definitely not a seasonal flu when you can impact.
7 million
What's that?
that in the United States who have presumed to be
Okay,
infected.
so 7 million. But the 25 million plus around the world,
Right.
that's an amazing number, especially with the number of countries
Right.
that are impacted. So it's definitely
Yeah.
different than the flu.
Okay, so hopefully that convinces you. If not, go ahead and do your research, but look at good research. Look at our medical journals, look at the information that's coming in from around the world, and you'll see very clearly that this is not a simple flu bug,
Right.
and it needs to be handled in a different way.
Okay, Justin?
So we've actually kind of hit all of the questions that we received through the week, but one that I want to kind of hit on again, the consequence for not following the public health order by Director Gordon's office. So it's a little different than previously with the EOs. That was with the EOs previously, it was a $1,000 fine and criminal misdemeanor. This is a little different. You can be fined civilly up to $1,000, and you can also be criminally prosecuted with a fine of not more than $200 and 6 months in jail. So there's two sides to this instead of just the one side with the EO, just the criminal only. So with this one, with the public health order, there is a civil fine that can be attached.
Closing comments.
Do the right thing. We're right there, people. What works, we know what doesn't work, and I'm asking all of you to just do the right thing.
Yeah, so this is not a simple response or operation. This has many moving parts from not only the health department, from my office, from all of our public servants, and all of the private citizens around our county. So it's going to take a full effort from all of us as one team to make sure that we do the best we can through this response and through this pandemic. So I thank you very much for all the hard work that you are doing out there, and we're just going to need to keep it up or push a little harder to make sure we don't fall over the edge.
Thanks for tuning in, and we'll
Yep.
see you next week.
Have a great day.
Bye.